name's Jessica. I'm going to be your student nurse today, and
Okay.
I'm just going to be performing a physical assessment on you. It's a head-to-toe assessment that's just going to let me know what's going on with you.
Okay.
So, can you give me your name and your date of birth, please?
Jessica Powers, 10/25/92.
Okay, and do you know what today's date is?
September the 5th of 2018.
Okay, and where are you located?
I'm at the Massimo Community College Health Campus.
All right, patient is alert and oriented times 3. I'm going to go ahead and take a set of vitals. I'm going to start with your heart rate at your radial pulse. Your heart rate was 68. Your rhythm was nice. It was appropriate, no abnormalities. It was a 2+, and your respiratory rate was 12 breaths per minute.
Okay.
So I'm going to go ahead and do your blood pressure. You might feel slight pressure,
Okay.
but it'll only be for a minute. Okay, are you ready? Sorry.
You're okay.
Okay, so I'm going to go ahead and feel the rest of your pulses, if that's all right.
Okay.
So I'm going to start with your carotid. Okay, it's 2+. I'm going to test your brachial. Okay, it's 2+. We already tested your radial, and it's 2+. It's a good rate and rhythm. I'm going to move to your popliteal. Okay, it's a 2+. Move to your posterior tibial. Okay, it's 2+. I'm going to take your shoe off, okay?
Sorry.
Well, I'm going to time first. I'm going to leave your sock on. Okay, and your dorsalis pedis is a 2+. And I'm just going to leave your shoe off if that's okay with you.
Okay, that's fine.
All right, so I'm going to move on to your head. Actually, I'm going to test your skin first. I'm going to touch your leg, okay?
Okay.
All right, skin is warm, dry, and tacked and pink. I'm also going to touch your arm. Warm, dry, and tacked and pink as well. I'm going to test your turgor. Okay, turgor indicates that you're well hydrated. I'm going to test your cap refill. Okay, cap refill is less than 3 seconds. It means you got good circulation. We're going to move on to your range of motion now. Okay, so if you don't mind, just stand up. I'm sorry about your shoe.
It's all right.
And we're just do what I do. Okay.
Okay.
So we're going to start with your neck. So put your chin to your chest. Now up to the sky. Okay. Now touch your ear to your shoulder. Here's the other shoulder. Do a full circle with your neck. Okay. Now I'm going to press against it. Don't let me move you. Okay. On the other side. Okay. Range of motion is fully intact in the neck, and muscle grade is a 5. We're going to move on to the arm. So I want you to raise them up high. Okay. Not out into the back. Okay. Push them up. Give me a little circle the other way. Okay, now I'm gonna test your arms, okay? So I'm going to pull against you, don't let me pull you. Okay, I'm gonna push against you, don't let me push you. All right, now just do this. Okay, now with my wrist, follow me. Okay, remind to squeeze my hands. All right, full range of motion in the shoulder, elbows, and wrist. Muscle grade in the arm is a 5, muscle grade in the hands are a 5 as well. We are going to move on to the leg. So what I want you to do is bring your knee to your chest. Okay, now just do a little kick. Okay, put it back down. We're just gonna pivot to the side. Do a little circle. Okay, push it back. Out again. Do a little circle. Put it up. Put it down. Okay. You mind to go ahead and take a seat for me? Okay, so I'm gonna pull against your legs. Don't let me pull you. Okay. I'm gonna push against your legs. Don't let me push you. I'm gonna push against your foot. Don't let me push you. I'm gonna pull against your foot. Don't let me pull you. All right. Full range of motion in the hips, knees, and ankles. Muscle grade of 5 in the legs and in the feet. So we're gonna move on now to your head. Okay, I'm going to look through your hair just to make sure everything's going good. Scalp is white. I don't know any lesions or masses. I don't know any tenderness. Hair is evenly distributed. It's the appropriate color. I'm going to move on to your temporal artery. Okay, 2+. I'm going to move on to your temporomandibular joint. Do you mind to open for me? Okay, now close. Now clench your teeth. Okay, there's no popping in the artery. There's no crepitus. Cranial nerve 5 is intact. Do you mind to smile for me real big? Now frown. Now raise your eyebrows. Now puff up your cheeks. Cranial nerve 7 is intact. I'm going to feel your frontal and your maxillary sinuses. Okay. Okay. So just tell me if you feel any tenderness.
No.
Okay. Or no?
No.
No? Okay. Don't note any lesions on the arms, legs, or face. I'm going to move on to your eyes. The external structures are present. Eyebrows and eyelashes are in good standing. I don't note any drainage or lesions or masses. So I'm going to pull down your eye, okay? Conjunctiva is pink and moist. Sclera is white. I'm going to go ahead and grade your pupils. Pupils are 3, they are round and they are symmetric. I'm going to test cranial nerve 3 for directing consensual response. So I'm just going to shine this light into your eyes, okay? Okay, now on the other side. Okay, directing consensual response is present. I'm going to have you look out that way. Okay, now stare at my pen. Okay, now follow my pen to your nose. Pupils are equal, round, and reactive to light and accommodation. Cranial nerve 3 is intact. So just follow my pen. Don't move your head, just your eyes. Okay, this is cardinal gazes, and it's testing cranials 3, 4, and 6, and they are intact. So we're gonna move on to your nose, which I still need my pen for. Okay, I'm gonna look into your nose. Okay, nasal mucosa is pink and moist, and you don't have a deviated septum. Nose is symmetric. I don't note any masses or lesions. I'm going to test the patency of your nerves. So what I want you to do is I want you to cover one nose. Take a deep. Okay, on the other side. Okay, now I'm going to test cranial nerve 1. And I need you to close your eyes. I'm going to put something in front of your nose. I need you to tell me what you smell, okay?
Okay.
Okay, what do you smell?
Alcohol.
All right. And now test that bilaterally. Okay, you can open your eyes, and we are going to be moving on to the ears. The ears are symmetric. They are in the appropriate place on your head. I don't note any lesions or masses. I don't note any drainage. They don't look to be red. I'm going to palpate. I should probably just hold this thing. Now tell me if you feel any tenderness.
No.
No? All right, I'm going to take to look into your ear, okay? All right. Oh. Well. Okay. Tympanic membrane is pearly gray, shiny and translucent. The canal is clear. And we are going to be moving on to your mouth. Okay, so what I need you to do is open up real wide. Okay. Now, raise your tongue up. Floor of the mouth is glossy. Your teeth seem to be in good repair. You can put it down. Soft to hard palate are present. Do you mind to stick your tongue out? Now move from side to side. Okay, now open wide one more time. Uvula is midline and tonsils are grade 1. All right, thank you. Oh, gums and buccal mucosa are pink and moist. And I don't note any lesions or masses in the mouth. And you have 28 pearly teeth. We're gonna move on to your neck. Okay, so I'm just gonna palpate right here for your trachea, okay? Okay, neck is symmetric. It is, the trachea is midline. I don't note any JVD or pulsations. I don't note any lesions or deformities or masses. So from here, I'm going to feel your lymph nodes, okay? So we have your preauricular, we have your posterior auricular, we have the occipital, we have your jugulo-digastric, we have the submental and the submandibular, we have the superficial cervical, posterior cervical, deep cervical chain, and the supraclavicular, and there are no lymph nodes palpable. Okay, so we are going to move on to our we're going to move on to our upper extremities. So just put your arms out. Okay, I don't know any lesions or deformities. Appropriate skin color, pink and moist and intact. Let's go ahead and test our fine motor. So I want you to touch your fingers to your thumb. Okay, fine motor is intact. I'm going to go ahead and feel your trochlear nerves. Okay, and for all of the pulses, I would have done them bilaterally. Okay, and I'm going to move on to breath sounds. Okay, so we have one, two, three, four, and five. No adventitious breath sounds. We're going to move on to the back, posterior breath sounds. One, two, three, four, five. Oh, six, seven, eight, nine, and 9. Okay, we are going to move on to your heart sounds, but I noticed that your chest is a 2-to-1 ratio. No deformities or lesions are noted. I don't know any redness. I didn't feel any tenderness or wincing when I assessed your breath sounds. I didn't know any pulsation of breath either. So we are going to move on to your heart sounds, okay? Okay. So we are going to start with your aortic heart sound on the second intercostal space on the right side of the sternum border. We're going to move on to the pulmonic valve on the left side second intercostal space of the sternal border. Moving down to Erb's point, which is the third intercostal space on the sternal border. The fourth one is your your tricuspid valve on the fourth intercostal space of the sternal border. And then we have the mitral heart sound on the fifth intercostal space, mid-clavicular line. I'm going to listen to this for a full minute. Rate was 64 beats per minute. No murmurs. I didn't know any abnormal sounds, S1 and S2 were present. I'm going to go ahead and test cranial nerve 8. I'm going to go behind you and I'm going to whisper something in your ear, and I just need you to repeat it for me, okay?
Okay. Cranial nerve 8 is intact.
Cranial nerve 8 is intact. So we are going to move on to your abdomen. So I just need you to lie down for me. Okay. The abdomen appears to be flat and symmetric. Umbilicus is midline. I don't note any pulsation. I don't note any drainage, lesions, masses, hernias, or wounds. I'm going to go ahead and listen to your bowel sounds. Okay. I'm going to start in the lower right quadrant. Go to the upper right quadrant, go to the left upper quadrant, and the left lower quadrant. All bowel sounds were normal active. If they were hypo or hyper, we would listen to them for a full 5 minutes. You can go ahead and put your legs out to a sitting position. I'm going to test cranial nerve 11. So what I need you to do is stroke your shoulders. Like that. Cranial nerve 11 is intact. I'm going to test cranial nerves 9 and 10. So what I need you to do is just swallow for me. Cranial nerves 9 and 10 are intact. I didn't note any pulsation in the abdomen. I'm going to move on to your lower extremities. So what I need you to do is not much, I'm just going to assess it. Legs are symmetric. I don't note any lesions or deformities. Okay, I'm going to move on to, I'm going to test your reflex. Ready? Okay, reflex is intact. Okay, I'm going to move on to your foot. And I'm just going to take off your sock for this, okay?
Okay.
Okay. Toes appear to be lesion-free. The nail bed is good, appropriate color. It's warm, dry, and intact. The bottom of her foot is callus-free, and it looks to be appropriate. So I'll put your sock back on, and I'm going to test edema. Edema is not present. I test all needed bilaterally. Let's go ahead and test cranial nerve 12. I'm not sure if I ever did this or not. So what I need you to do is stick out your tongue and move it from side to side.